Now we will be hearing from different organizations that work on issues affecting transgender, non-binary and intersex folks, reflect on how the work has been done historically, what they are doing today, and what their future visions for our health and our lives look like. So I would like to welcome on stage Johannes Edenteg from FPES.
Hej, mitt namn är Johannes och jag är förbundsordförande för FPES, Föreningen för transpersoner. Jag kommer att ha den här presentationen på svenska, så är det någon som inte förstår så räck upp handen, eller så får vi försöka förklara på engelska på bästa sätt. Föreningen bildades i november 1966 och till en början så var det här en förening för enbart transvestiter. Så ser det inte ut idag, utan idag så är det väl lika mycket transpersoner som är med i föreningen. Vi försöker ju och synas och höras så mycket som möjligt. Och vi tog väl FPES in i en ny dimension för ett tag sedan. Det här är lite det som vi försöker arbeta med när det gäller FPES. Myndigheter, politiker som vi påverkar, vård och omsorg, diskriminering. Men oj vad snabb den var den här då. Jag hinner inte riktigt med. Men jag får fortsätta prata i alla fall. Vi har idag ett par avdelningar också. Och vi finns över hela Sverige. Och vi har även samarbete med Norge och Danmark som också har systerföreningar. Som brukar träffas ibland, men framförallt digitalt. Det här är lite det som vi försöker fokusera på när det gäller FPES. Neutrala personnummer, likvärdig vård för transpersoner och bemötandefrågor. Vi har ju jämfört med Transammans så har vi ju den äldre generationen transpersoner. Och där handlar det också lika mycket om bemötande och bli bemött på ett bra sätt. Och det handlar ju då om att man kommer in i vuxenlivet och arbetsfrågan framför allt. Vi kommer att hålla ett stort seminarium om det på MR-dagarna där vi pratar om utsattheten för transpersoner på arbetsmarknaden. Här är ett av våra argument till, som vi har pratat om när det gäller personnummer. Att skydda den personliga integriteten. Ingen ska per automatik behöva dela personlig information som ålder, kön i obekväma situationer. Och här är lite argument. Personnummer är en bristvara vissa dagar på året. Som vi har tagit fram. 499 män och 500 kvinnor är tillåtna i dagens när det gäller personnummer. Att ta bort den binära könsmarkeringen skulle på kort sikt ge tillgång till att alla 909 har möjlighet till ett nummer per dag. Och det här är ju ett problem när det gäller Skatteverket. Jag kan bara relatera till att jag bytte personnummer 2015 och av en tråkig händelse här för ett par dagar sedan så skulle jag ha ett intyg från Skatteverket och jag är fortfarande registrerad som kvinna och bytte personnummer 2015. Så vi ser ju att det här är ju någonting som vi behöver jobba vidare på. Likvärdig vård för transpersoner. Det finns ingen grupp som är så utsatta som transpersoner när det gäller vård. Man jämförde för ett tag sedan, eller för några år sedan, cancervården med transvården. Och då konstaterade man att det finns ingen vård där man sidosätter sina känslor och sin längtan till att få sina operationer. Man säger ju inte en cancerpatient, men du, nu har vi hittat en tumör på tarmen här, men du får vänta 5-6 år och sen så opererar vi dig. Men när det gäller transpersoner så verkar det som att det är men vi ska vänta på våran tur. Och därför så finns det ju också ett ökat antal som även genomför suicidförsök, och det även går väl inte så bra alla gånger. Varför driver FPES dessa frågor då? FPES vill åstadkomma såväl kompetenshöjning som lika behandling inom vård av personer med könsdysfori. Och det märker vi ju när det gäller arbetsmarknaden idag, av den orättvisa som det gäller när det är en transperson och en cisperson som söker ett arbete. Kommer det till arbetsgivarens kännedom att personen är trans, så väljer man oftast att anställa cispersonen. Och det här är alltså ingen hemlighet, utan det här är ju någonting som för många företag även stolt berättar. Så vi ser ju av de medlemmar som hör av sig till oss ibland när det gäller sånt här, så de vågar helt enkelt inte berätta att man är trans, utan man tar sitt jobb och sen successivt, sakta men säkert, så berättar man för sin chef och arbetskamrater att jag är trans. Och det finns väl fall där man till och med blir avskedad efteråt på grund av det här. Och det här handlar om bemötande, som också är en fokusfråga för oss. Och det var jag inne lite på innan här, att det handlar om en okunskap. Och det handlar om en okunskap som gör att folk inte vill ta till sig det här. Och då gäller det arbetslivet, men det gäller även skolor. Jag tror att ni säkert har läst hur det ser ut nu på att skolorna får nu individuellt bedöma från barn till barn. Om ett barn kommer och säger att jag har bytt pronomen och jag har bytt namn, så är det inte en självklarhet att det skrivs in i de här dokumenterna. Utan då får man bli felkönade, och det ställer till katastrofala saker. Vi försöker, det vi har som fokus nu, det är ju den här nya könstillhörighetslagen som är väldigt viktigt för oss, som vi jobbar med. Men vi jobbar även med att nå ut till glesbygd och de som inte vågar komma ut. Så det är väl de stora fokusfrågor som vi ändå jobbar med under FPES just nu. Ja, det var lite kort. Jag hade inte så mycket mer att säga så om FPES. Men jag sitter som ordförande och jag är tillgänglig. Jag jobbar måndag, onsdag, torsdag med det här. Så man kan ringa mig eller man kan mejla oss. Så det var lite om FPES.
So thank you so much, Johannes. I would like to welcome to the stage Signe Krantz from Transammans to deliver a speech.
I have no presentation, so if you want some info on text, I recommend you heading to our webpage, transammans.se, where we have information on all our activities, on our organization, and the like. You can also become a member if you want to. My name is Signe Krantz, and I am the chairwoman of Transammans. Transammans is an association for trans people and close ones for trans people. We started at 2013, and as a way for trans people and parents of trans peoples to have more meeting places, more places to gather, talk about our experiences and the experiences of our close ones. Because the thing that they realized was that even as a parent to a trans person, as a supporter, as a supportive parent, you also have a need to discuss your experiences, talk to other people with it. And that's why both close ones and trans people have always been the same obvious part of our organization. You'll have to excuse me, I recently drank like a cup of coffee too much, so I'm feeling a little jittery right now. I never learned my lesson. So Transammans work with in 3 areas. We work to gather. Trans people and close ones. We have activities throughout Sweden, and that's everything from brunches to fikas to larger member conferences. We also have a bunch of activities at Pride. Our second part is informing. We work with informing companies, government agencies, municipalities, regions, and the like on what does trans mean, what are the current issues facing trans people, and what do we think should happen for them to approve. And the third is that we work with advocacy work, and that's mainly where I work. We have contact with government agencies and politicians, and also with the public at large to say that these are the problems that trans people are facing. These are also the problems that close ones of trans people are facing. And this is what we think should happen for that to improve. Now, the way I see it is that to improve the situation of trans people in Sweden, there needs to be an ecosystem of activists and organizations and initiatives. Hälsoplattformen is an excellent part of that ecosystem. We are also a part of that ecosystem. During the last 10 years, we have also seen Transfersvaret, and we have seen dozens of activists working on their own terms with their own accounts by their own power. We see Cinema Queer, we see Transfest, we see every single Pride celebration across Sweden. We are part of one ecosystem. We don't have the same methods. Sometimes we don't have the same goals in every way. But we are part of an ecosystem, and we need to work together as an ecosystem. For us, as Transammans, we have an office for employees. We take a lot of government funding. We have politicians that go to us and ask for our opinion on things. We mainly work directly toward those politicians, because the way we see it, that's our niche. Our niche is being able to have those conversations, to talk the politicians' language to politicians, and also open the door for activists for other parts of that ecosystem to also get access to those rooms. How much time do I have? 5 minutes? Ooh, plenty of time. Nice. Right now, we, of course, work the most with the gender recognition law, where our goal, long term, is to have full legal gender self-ID in Sweden. However, that's the way we see it, not practically realistic now. We wish it were, but there is a in the parliament there is a stable majority for a version of gender recognition that's slightly better than what we have now. But I think that we are unfortunately a few years away from full legal gender self-ID. And I would love to talk more about that with any of you in the break or later today. We also work with trying to lower the waiting times of getting trans healthcare. We are also in contact with trans healthcare providers to give our view on what problems that trans people are facing, and try to further the conversation and further the recommendations in a way that's better. So, because with this excellent 2 videos that we just saw, no person should ever have to hear those things from someone that they need help from. That's unacceptable. We also have a what do you say? Like a psychologist that works at our office to specifically give mental health talks to younger trans people. Curator, how do you say that in English? I don't know. Like counselor. Thank you. So if you're under the age of 26, you can book a time to talk to them. We are also starting a project focused on older trans people, because, like Johannes said, and that's something that that's a group that we are not organizing enough. I am very thankful for the opportunity to be here and talk about us, about Transammans. We are quite new on the stage of the Swedish public, but we see our work as a part of this ecosystem, and I think I'm optimistic because I see all the power, all the enthusiasm that is here. Parallel with the, excuse the French, fucking shit that we are subjected to every day in media, on social media, by politicians, there's also so much good. Because what we see is everyday people talking to us, saying that we want to do something. How can we do something? Give us the opportunity to be better. And tell us about this. Why is this so important to you? And the way I see it, that for every time there's some big medial backlash against us, there are dozens of small things that will never reach a viral point that happens that are good for us. In companies, in agencies, in municipalities, in associations, people that stand up for us and say that, hey, this should happen. The only reason that the backlash is so strong right now is that because the people who do not want us to have rights and would prefer if we did not existed, and if we do exist, stay over there somewhere, they are so loud right now because they are desperate. They are so loud right now because they have lost ground for 20 years. There is a backlash now, but it's turning. The question is when it's turning and how worse things will become before it's turning, but it's turning. And up until then, we need to stand together. We need to see what can unite us and how we can work together. How can we complement each other? How can we share our different experiences through our different methods? I'll be here for the rest of the day, and I would love to speak with any of you that are interested in what we do and why we do it. And with that said, I thank you for the time.
So next up we have a video from Paloma Halén Román from Patientförening, and the video recording is in Swedish.
Hej, jag heter Paloma Halén Román och jag är ordförande för Patientförening för transpersoner. Vi är en ideell förening som riktar sig till personer som är i, varit i eller önskar komma i kontakt med den könsbekräftande vården i Sverige samt närstående till de här personerna. Vi riktar oss även till andra som vill verka för en bättre könsbekräftande vård i Sverige. Vi gör det här mestadels genom påverkan, så vi har möten med politiker och de olika vårdteamen och Socialstyrelsen och så. Och vi skriver ganska mycket remisser där vi kommenterar hur vi tycker att vården borde utformas. Vi har några grundinställningar vad det gäller den könsbekräftande vården. Det är framförallt att vi måste arbeta för att korta vårdköerna till den könsbekräftande vården och även liksom i den, så att det inte blir så långa utredningstider. Vi vill verka för att vård ska ges till alla som har behov av könsbekräftande vård. Vi vill också verka för en bättre uppföljning av de som går igenom den könsbekräftande vården, så att man inte bara släpps när man har liksom fått en diagnos, utan att man fortsätter ha uppföljningar. Vi vill också att det ska bedrivas bättre forskning på effekterna av könsbekräftande vård. Och sist men absolut inte minst så verkar vi för en jämlik och förutsägbar vård. Och med det menar vi att tillgången till vården ska inte bestämmas av vart du bor till exempel. Och att du som patient ska kunna veta hur din vård kommer att se ut. Och att det inte ska vara en jättestor skillnad om du söker dig till vården i Stockholm eller i Umeå eller i Göteborg, utan att det ska vara ungefär likadant. Det vi arbetar med just nu, det är att vi försöker driva påverkan kring nationell högspecialiserad vård och hur den implementeringen kommer att se ut. Vi bevakar också frågan kring en ny könstillhörighetslag där vi ser att det vore väldigt bra om man kunde separera juridik från medicin. Sen håller vi också på med en rapport som vi hoppas ska bli klar innan årsskiftet. Där vi presenterar patienters upplevelser av den könsbekräftande vården. Vi tycker att det är många som pratar om hur den könsbekräftande vården är, men att man väldigt sällan får höra patientperspektivet. Så det är för oss väldigt viktigt att få ut. Det var allt för mig. Tack så mycket för er tid.
And next up on stage we have Lidman from RFSL Ungdom.
Hello, my name is Lidman. My pronouns are they, he, and I'm the Vice President for RFSL Ungdom, or Queer Youth Sweden. And we are a youth-led organization that works with queer rights for youth specifically. We have existed for 20 years now, and we were founded, we were first a group within RFSL, and then we thought we needed our own organization 20 years ago, so we started our own organization. On a national level, we work a lot with policy and legislation, trying to affect it, talking with politicians and governmental agencies. We also have activities with educating people in society, governmental agencies. We also work with support for queer youth that need help, information, someone to talk to. And we also throughout the country have local organizations that focus on affecting legislation and policies on a local level, and also have a lot of social activities to create a safe space for queer youth. Right now, we have a big focus on the new proposed law for about legal gender recognition. We are not happy about the law at all. It is a small step in the right direction, but it's way, way too small. We want to see a law that is based on self-determination. We also want a third legal gender, or to remove legal gender as a thing completely. But unfortunately, we're not quite there yet. So our focus is to get this law passed, because it is a little bit better than what we have today. But then we will right away continue working with reaching these goals of self-determination and removing legal gender. With this law, we are also working with, because how it's written, the National Board of Health and Welfare, Socialstyrelsen in Swedish, is still supposed to be a part of the process of changing your legal gender. So we also have a big focus on trying to make sure that that will just be an administrative process and not land on the legal advisory board as it is today, so that they will not be as involved as they are today, and the whole process will be a lot simpler. So we're hoping we can affect that. We also work a lot with school, since our focus is youth, trying to make a safe space for queer kids, and yeah, remove bullying and making sure that they get the education that they need and deserve. Right now, we also have a big focus on banning conversion practices. There was a governmental study inquiry that was done this year that proposed no changes to the existing regulations. So they don't want to ban conversion practices in Sweden, pretty much. They think that the current laws are enough. We don't agree at all. So we are right now working very hard to actually implement a ban completely on conversion therapies. So we are trying to work together with our other organizations and talking with politicians and spread awareness about these issues. And when we come to healthcare, of course, we work a lot with the gender-affirming care. The waiting times is, it's just insane how long they are. It's not acceptable in any way. So the gender-affirming care needs more resources. They need more knowledge. And the whole debate about gender-affirming care needs to be based on actual factual information, and not just trying to talk shit about trans people and trying to erase our existence, pretty much. But I also want to talk about healthcare in general, where there's also a big problem, not only with the social interactions, like healthcare professionals treating patients with respect. That is, of course, very important, but I feel like the conversation is often focused on that area, and I think that we also need to put focus on actual medical treatment, because today medical guidelines are very much based on a white and binary idea about gender, and there's very little knowledge about how that affects trans patients specifically. So I think we need to focus a lot more about that, and I think we as civil society has a big role in trying to get this, start talking about this, and trying to get healthcare to talk about this, because it's not really talked that much about today. I also want to mention our work with trying to stop unnecessary interventions on intersex people. Yeah, no interventions should be done if it's not medically necessary until you're old enough to decide for yourself what you want. We should not force surgeries onto babies that cannot decide for themselves. And circling back a little bit just to healthcare in general, my passion is also technology. I'm an engineer and work as an engineer at Sahlgrenska University Hospital. And technology in healthcare, I think, has a great opportunity to make healthcare better, but we also need to really make sure that it is designed for everyone. There is a lot of talk about AI right now, and there's great potential in AI, but it also needs to be designed in the right way. It is very easy to have the training data sets be very binary, and there's again little research about how this affects specifically trans people. So I think we need to put pressure and talk more about these issues as well, because it is the future of healthcare. Technology will just be more and more implemented, so it's very important that we from the beginning make sure that the technology we implement actually work for all patients. And lastly, I want to say that we are also a member-based organization, like so many others here. There's a lot of organizations in the Swedish civil society, and I think we all need to work together. If you are between the ages 0 and 30, you can become a member of RFSL Ungdom. It is completely free. And then you support us, and you can also become an active member and try to work with us to affect policy and create safe spaces for queer youth. And the last thing I want to say is that we are a lot of organizations. I think this initiative from Hälsoplattformen is really great. I'm really happy to see so many people here. And today, when we see all of this backlash towards trans people, how the public debate is becoming more and more toxic, I think we all need to work together to try to stop this. We need to organize, we need to rise up and meet this resistance together. Thank you.
Next time we have another video entry from Yaran Rostam, who is a trans health expert at RFSL. So.
Hi, my name is Yaran Rostam and my pronouns are they, them. I work as a trans rights and health expert at RFSL. RFSL was founded in 1950 and today we have over 8,000 members and 33 local branches. We work on a local, national and international level to ensure LGBTQI people's rights. Since around 2000, RFSL has been working intently with the rights of trans people, and some of the biggest issues that we've been part of fighting for is making sure that trans people got included in the discrimination law in 2009 and prohibiting the forced sterilizations in 2013. Since 2017, we have also been giving support to trans people, their loved ones and professionals through transformering.se, together with RFSL Ungdom, who started the initiative in 2010. Right now, our main focus areas regarding trans rights in Sweden are a new gender recognition law based on self-determination and improving the gender-affirming care by making it more accessible, shortening the waiting times and making sure it's based on individual needs. We're also challenging the media narrative and the disinformation regarding trans issues at the moment, because we see that it's connected to a bigger backlash that's aimed specifically towards trans people's rights, and it's affecting us all. Our political advocacy work is done in different ways. Much of what we do is building an opinion through debate articles and different campaigns. But we also do direct advocacy work towards politicians and the healthcare system, where we, through meetings, try to impact praxis and decisions. A less visible, but still very important way is also writing suggestions and replying to different investigations and proposed laws, so-called remissvar. And we also try to increase the public awareness and knowledge through education panels and seminars. RFSL's vision is a world with equality, where the human rights of all LGBTQI people are respected and no one is left out. We want trans people to be able to live fully, without discrimination and with access to gender-affirming care and a correct legal gender. And of course for non-binary people as well, and regardless of age. As a feminist, anti-racist and norm-critical organization, our long-term goal is to break down the systematic oppression of trans people and LGBTQI people. Thank you and good luck with your conference.